February is Heart Health Month, and joining us today is Dr. Ryan Longmore with Portneuf Medical Center's Cardiology Department. Good afternoon to you.
Hello.
Oh man, so it's a heart month today. We're focusing on all things heart. Now, your involvement in this whole process, the center engine that drives us, our heart. Tell me a little bit about what cardiac scoring is.
Sure. So when we say cardiac scoring, we're referring to calcium scoring. And so over time, as we develop plaque in the arteries of the heart, that shows up as calcium. We have calcified plaques that can obstruct blood flow through the heart, basically.
Okay.
And so the way we do a cardiac scoring or a calcium score is we do a low dose, a low radiation dose CT scan of the chest. We don't need any IVs or IV contrast, takes about 5 minutes.
Okay.
And then once we have those images, we can integrate that into a score called the calcium score. And that calcium score has been shown to correlate really closely with an individual's chance of developing heart disease, having a heart attack, stroke, or even death over the next 10 years.
Okay, so at what age is this a type of procedure that is recommended by your doctor, or at a certain age, kind of like with different tests, you just need to go in and get a score?
Sure. So we recommend this frequently as cardiologists because we want to find out this type of information. I'm a preventive cardiologist, so I want to prevent people from having future events.
Okay.
And so the type of people that we would recommend would be people over the age of 40 years old that have risk factors for coronary artery disease. So that would be high blood pressure, diabetes, high cholesterol, a family history of heart disease, or a history of smoking. Okay. So it really covers a lot of people. And when my friends and patients ask me what's the best thing that I can do to find out what my risk is of having heart disease, this is what I recommend. Okay,
and so when people come in to see you, like you said, it's not a long process, it's something that can be done. And then once you get the results back, and let's say somebody has a high score on this, or if it's like a credit score was high is good and low is bad, but this is the opposite.
Yeah, exactly.
There are things that they can do that you recommend that they can do to kind of like ease that number down a little bit.
Yes, yeah, so that information is invaluable to us because then we can put together a treatment plan that can hopefully decrease that risk of having those heart events over time.
All right, thank you so much, Dr. Ryan Longmore, for coming in. And if you'd like more information, you can go to Healthy City USA on Facebook and check it out. Thank you so much for joining us today.
Thank you.